Now, we often talk about the impact homelessness has on families in the capital, but BBC London has been hearing about the extra challenges faced by neurodivergent children. Parents living in temporary accommodation say children with conditions such as autism are slipping through the cracks with cramped housing and repeated moves, making symptoms worse. Whilst there are no official figures, researchers estimate tens of thousands of families across the country could be affected with housing and education systems failing to work together. Dr. Rosalie Warnock is from King's College London and the Shared Health Foundation is one of those researchers and joins us now. Dr. Warnock, good morning.
Good morning, Aaron. How are you?
Yeah, very well, thank you. Thank you for joining us. This is really interesting. I mean, sort of paint the picture for our listeners this morning of the conditions and circumstances that the families we're talking about here are living in.
Yeah, so for neurodivergent children, temporary accommodation isn't just actively harmful. Some of the parents we've spoken to have described it as being almost like torture for their children. And this is because for neurodivergent children who might have heightened sensitivity to light or to noise or to smells or touch or temperature, they can't control or adapt these things within TA like you would in your own home. And this can lead to extreme sensory dysregulation and meltdowns and really affect children's mental and physical health. And another thing that neurodivergent children can really struggle with in temporary accommodation is the uncertainty and the changes to their routine. And this is because families can be expected to move at very short notice. And this disrupts routine, access to schooling and social and support networks. So it's really common for children in temporary accommodation, especially neurodivergent children, to stop going to school, particularly if they're moved far away because they struggle with public transport or their mental health becomes so bad. So this means that not only are those neurodivergent children missing out on learning, but also that their parents can't work because they're caring for them 24/7.
Obviously, there's not much official research on this, but it's something you've been looking into. I mean, in terms of the actual investigation, what sparked it? What triggered us wanting to look into this deeper?
So family homelessness isn't very well researched or understood. Most of the research is on rough sleeping, but this is a huge issue. So in England alone, there are 176,000 homeless children right now, and 100,000 of those are in London. So this is a really big issue for us in the capital. So in London, that's 1 in 21 children who are homeless, or just over 1 in every school class, which is pretty wild. And this doesn't include children who are sofa surfing or children in home office temporary accommodation either. So we need to learn a lot more about family homelessness and what's going on and what to do about it. But within this, there's this additionally hidden group of neurodivergent children. And again, as you said, we don't know how many children are neurodivergent in temporary accommodation. Department for Education estimates that 1 in 7 children in England is neurodivergent. So we're looking at least 25,000 neurodivergent children who are having to deal not only with being homeless and living in temporary accommodation, but some of these additional challenges that I've been talking about today.
What's the situation right here in the capital?
And so in the capital, 100,000 children are homeless. This is about 1 in 21 children across the capital. So that's at least one child in every school, in every school class. And what we'd really encourage your listeners to do is to write to their local MP and ask them what they're doing to tackle homelessness in their area. And this is particularly an issue in London, not just because of the numbers, but because of the ways that families are moved between boroughs or out of area. Which causes a lot of extra stress and difficulty for those families.
How, I mean, barring sort of writing to our MPs, in terms of your research, what are we hoping to achieve? And is there any way that it can be, I don't know, is there anything to sort of, take the situation forward? Can we try and improve things here?
Yeah, I really hope so. So we're working with policymakers and charities to try and push for some specific changes. And we're pleased to see that the government is taking steps to apply the decent home standard to temporary accommodation. But this isn't meant to happen until 2035. So for the reasons we've discussed today, we need this change to happen quicker for neurodivergent children so they can live in better quality accommodation and just get on with their lives, really. And so also from September, there's going to be a new notification system where local authorities have to let a child's school and their GP know when they become homeless. And this is to kind of join up services. But we'd really like to see that extended to include a specific flag for children with education, health and care plans, or who are on the SEM register at school. Because as we've said, at the moment, we just don't have the data on how many neurodivergent children are in temporary accommodation. And without that data, it's really hard to be able to push for these specific changes.
Really appreciate your insight this morning, Doctor. Thank you so much. Have a great day.
Thanks, you too. Bye-bye.
Dr. Rosalie Warnock from King's College London and the Shared Health Foundation. Really interesting insight into that research there on what is a difficult situation for neurodivergent children, for families who are struggling with homelessness, temporary accommodation not suitable for the needs of their children as well.